Okay, good morning, everybody, or afternoon, depending upon where you are. Uh, Today's session is about measuring food insecurity in the area of the COVID-19 epidemic, revisiting data collection activities with a focus on practical insights and lessons learned. I want to start with, if we can go to the next slide. Okay, so before we get really started, all video and microphones are muted during the presentations. There's a Q&A button at the bottom, which you should use to submit questions for the panel. The session, not use the chat. The chat is if you want to communicate with Riley as the organizer. A recording of the webinar will be available on the Data for Nutrition YouTube channel right away, and then the presentations and a question and answer summary will be posted in the community in the coming week. Okay. So if you're having any trouble, then use the chat to communicate with Riley by selecting all panelists, and then she'll do her best to make sure that that's solved. Okay. I'm serving as the moderator. This is sponsored by the Data for Nutrition Community of Practice, which provides its members with opportunities to share knowledge, experiences, and questions relevant to strengthening nutrition data value chain at all levels. I wanted to begin by just reminding us that the first work that led to establishing food insecurity as a construct that applies to household and individuals was about 30 years ago, and immediately led to developing and validating questionnaires to assess these experiences at the household level, but also for individuals. And we know that doing so is important because food insecurity affects households and individuals in the households in terms of diet and nutrition, but also because it's a profound stressor that has close consequences that are physical in terms of hunger and tiredness, psychological in terms of anxiety, alienation, feeling deprived and having compromised choices, and is social, eating non-normatively, having to acquire foods in socially unacceptable ways, having family and social conflict and altered interactions. It's an important issue in all countries, in low, middle, and high income countries. And we now have prevalence data for since 2014 on about 3/4 of the world's countries because of the FAO Food Insecurity Experience Scale implemented through the Gallup World Poll. Crises such as the Great Recession in 2008 and the SARS-CoV-2 pandemic provide the need for an opportunity to create new ways of obtaining accurate and timely information about food insecurity and how it's changing and what that means for people's lives. The Gallup World Poll, for example, has already had to make substantial adaptations to be able to conduct its surveys by moving from face-to-face to telephone. So the purpose of the session today, let me introduce the panelists, is to, if I can go to the next slide, please. Okay, so before introducing the panelists, just to remind you that I mentioned the Food Insecurity Experience Scale. That module, a module based on that scale has been put into the DHS. It's an optional module, and this slide shows that you can go to the DHS website and access the module. Okay, next slide. Okay, so our today's speakers have been addressing in their work and with their colleagues this challenge of how do we assess food insecurity and how it's changing in the current environment. So our panelists are Divya Nair, who's director of IDInsight in New Delhi, Kenda Cunningham, who's the senior technical advisor for integrated nutrition and monitoring and evaluation and research as part of the Sahara 2 project, and Roni Neff from the US, who's the project director for the Johns Hopkins Center for a Livable Future. So we'll get started right away with each speaker. They'll each have about 7 minutes. I'll make a few comments after that, and we'll open it up for discussion. The questions that were given to the panelists were these four. What have you learned from the experience of phone-based interviewing on food security? What have you learned from analyzing these responses? What did or didn't work when you first started doing this? And what are you changing or keeping the same as you go forward? So I'll turn the floor over to Divya.
Thanks, Ed. Hi, everybody. This is Divya Nair. It's a pleasure to be part of this panel. Next slide, please. Next slide, yes. So to give you a little bit of background about why I'm talking about this topic, IDInsight has collected 6 rounds of data over the last 8 months. So it's been very intense for us, focusing on COVID-19 and its effects across a range of dimensions. Food security is one of them and not the only one. And we've used phone surveys to collect all this information. We've deployed our data on demand infrastructure, which is an in-house capability that we have, where we deploy about 1,000 surveyors that we have who are trained and managed by us to kind of collect high quality rapid data. And the goal of this was to provide information to the government regularly in terms of understanding how COVID is affecting households across rural India. The sample size was around 5,000 households in each round, and we covered between 6 to 8 states in India. So these are large surveys and representative of a large swath of the rural population. Next slide, please. And actually, kind of before jumping in, I wanted to highlight 3 key takeaways that I'm going to be talking about. The first is that over time, as you can see, given that we've been collecting this information for 8 months now, is that it's important to adapt over time. The second is that as you adapt, it's important to keep a few indicators that are consistent and constant over time so that you have a sense of, like what the change is looking like. And the third is that it's useful to triangulate and have some complementary measures to kind of understand what you're seeing. So what this slide is saying is that, when we started in April at the height of the lockdown, basically we deployed our data on demand infrastructure 10 days into the lockdown. What we found is that, these 2 indices were most relevant for us because we had to conduct this survey over the phone. We wanted it to be quick and policy relevant. And we chose the Coping Strategies Index, which focuses on coping behaviors in the context of food insecurity. And basically, after having used that, the first indices in the first round, we did switch to the FIES in subsequent rounds. So I can, next slide, please. I can talk a little bit about why we did that. Is, these are some of the questions that are asked in the coping survey. And what we found is that, the question around limited portion size or reduced meals was the one question that we found most useful. But what happened is that altogether, we were not able to kind of get the variation that we wanted to answer which kinds of households were most, stressed. We did find, especially early in the lockdown, that there were a lot of households reporting, for example, limiting portion sizes, but even, wealthier households were saying the same thing. And what we weren't able to get at is, the level of stress that, or the depth of, insecurity that these households were experiencing. And so we moved to the FIES. but we kept the limited portion size or reduced meals indicator consistent across rounds. Next slide, please. And so what that meant is that we used the modified FIES. As I mentioned, the first indicator stayed consistent. And this one talks a little bit more about, what is the experience of food insecurity. Did somebody in your household, sleep hungry or not eat for the whole day? So basically, we felt that this might get closer to understanding a little bit more of the experience of food insecurity, and probe a little bit into some of the subjectivity that exists. And next slide, please. You can see that we did May, July, September on the left-hand side. Again, the limited portion size indicator stands out as the highest, but the other indicators were really quite low. So from that perspective, we were happy to have stuck to that first indicator. And that one, next slide, please, really, is the one that we have kind of reported and used regularly, but we've also complemented it with new indicators, including those related to diet quantity and dietary diversity. So next slide. And that has been really useful because, for example, interestingly, even among households that limited portion size, when we look at the quantity of, for example, grains, rice and wheat that was consumed by those households, we actually found that those that were limiting portion sizes were consuming more grains. On the left-hand side, you can see that, the orange one is those that limited portion sizes, and across, they are consuming more grains. Next slide, please. So this is the quantity one, and we looked at whether these households are different, and these households were not very different in terms of average household size, in terms of, below poverty line status. So the question was, what's going on? And next slide. Because we had collected some information on dietary diversity, what we found is that what this slide is showing is whether households were consuming various other food categories. As you can see, for grains, there's not much of a difference between those that had limited portion sizes and not limited portion sizes, but there is a big difference in terms of meat, fruits and vegetables, and the most, and all of them, both those that did and did not limit portion size, are reporting having reduced quantity of dairy and other products. So basically, the story kind of comes together when you collect these complementary indicators. From a policy perspective, what we take away is that, grains is not the challenge here, but there are these other kind of food categories that are not reaching households later in the COVID experience, but a large proportion of households continue to limit portion sizes, and it's useful to kind of dig in a little bit to understand who they are and why they're doing so. So I'll stop here and pass on to the next person.
Hi, so as was mentioned at the beginning, I work with a project in Nepal called Swahara, and next slide. Next slide. So just to show those who are not familiar with the program, the yellow areas are the part of the country where we implement our intervention. So this is from the lowland plains areas that border India to the very high mountains bordering China. So we have a district-wide approach, meaning that we cover all the communities in the 42 districts that you see highlighted in yellow, reaching a target population of nearly 2 million households in the 1,000-day period, with integrated programming spanning health, family planning, nutrition, water, sanitation, hygiene, agriculture, markets, nutrition governance, gender equity, and social inclusion. Next slide. Next slide. So before jumping into the data collection, I wanted to highlight just a brief overview of how our social behavior change approach works, because approximately 80% of the Swahara efforts goes to household and community level activities to improve behaviors across those thematic areas that I mentioned. There are primarily 4 categories of SBCC interventions that we work on. One is interpersonal communication, primarily through a cadre of frontline workers, approximately 1,000 currently. It's gone up and down between 800 and 1,500 over the last 4 years. Those are home visits conducted by SWAHARA program-specific frontline workers. We also have community mobilization activities, which are primarily supporting the government's Health Mothers Group meetings, food demonstrations, key life events celebrating pregnancy, a child turning 6 months of age, and so on. We also have a program called Banchan Ama, What Mother Says, which is a radio program that has been running since 2012. It's a weekly radio drama series with a call-in component, and that was decentralized a few years ago so that the radio call is produced across the country in 14 different locations, and allowing more call-in and local experts to be receiving the calls and fielding those. And we also transitioned this to Facebook and YouTube to allow greater access and uptake among the population, which is increasingly using social media. And lastly, mobile platforms, including interactive voice response, SMS text message campaigns, videos, and so on. Next screen. So in the COVID-19 context, when we saw massive returns of migrants from India and the Middle East and nationwide lockdowns happening, we had to modify our interventions. And while the radio, Facebook, social media, and mobile-based interventions could continue, it was really our interpersonal communication that had to transition. So as you can see here, in some locations that meant a total reliance on telephone-based counseling. And then as the lockdown started to ease in some other locations, we could do interpersonal communication visits, but those were done using appropriate COVID-19 transmission prevention strategies. And this is the current situation remaining as of today. And you'll also notice on this screen that the group mobilization activities have not been happening for the last 8 months or so because group gathering is no longer advised and is actually prohibited by the federal government. Next slide. So that context is important because basically we decided that we would do some remote monitoring of food security during COVID-19, but really that monitoring was part of the telecounseling. So it was a program intervention. It was not a research study or primarily a data collection activity. What happened was when we transitioned to telephone-based interpersonal communication, we needed to design new job aids and distribute those to the 1,500 frontline workers who were working across those 20,000 or so communities in Nepal. And we trained all of those workers again to ensure that they were consistently asking questions about COVID-19 primarily, such as whether the household has had migrant returnees, whether the household has anyone with fever or cough, etc., that needs to seek medical care. And as part of that new job aid, we decided to integrate some simple questions that could help us to understand how food security was changing in different parts of the country. And we needed for that to use very short, validated, and easy to understand questions, both for our own frontline workers as well as for the respondents. And each of these frontline workers was responsible for making 10 phone calls a day. And if you do the math, this equates to about 90,000 phone calls being made per week to administer the telecounseling, and as a part of that, to collect data on the 2 questions that we chose. Next slide. So this was presented in the last webinar, so it's just to quickly remind that what we did was we used the validated USA screening tool that's known as the Hunger Vital Sign, and we had to make some modifications so that we weren't talking about a 12-month period, but we were talking about the present situation, and also that we were acknowledging that a lot of the food in Nepal comes from household production. It's not all store-bought food. So those are the modifications that we made and the 2 questions that we used. Next slide. So some of the uses of the data, which I think gets to the question of lessons learned. The first is that we were using the data for immediate counseling and suggestions by the frontline workers. So for example, a household that was flagging that they were starting to run out of food, we were reminding them about issues around inter-household food allocation, gender issues, and the prioritization of young children for healthy foods. We were also using this as a referral system and a linkage because the local government and also some other development partners such as the World Food Program were setting up relief programs throughout the country. But they were not collecting data to know which households were actually needing the services. So we had a complementary approach where we were collecting the data and linking the households into those relief efforts. The third thing is we've been sharing the data with the federal government and other stakeholders so that people can look at trends and also the survey findings to be able to guide their relief efforts of which communities across the country should be prioritized with, of course, limited resources. We've also had a collaboration with World Food Program. All of this data is now visualized in maps and graphs and charts, and municipal governments can log on and see their data and what happened over the time, which is helpful because the municipal governments know when and where they were actually giving those relief packages to be able to see if the trend aligns with the efforts that were going on. Next slide. So the 5 key lessons learned, I would say, from our side is, first of all, it was easy for us because we already had a mobile-based phone system in place with frontline workers. They were trained and familiar with how to use the tools. But time is definitely needed and is absent in a time of crisis. But the tools have to be adapted. Retraining is needed. They have to sync their phone to new applications, etc. The second is that you need a systematic documentation of how many calls were made, how many responses to those phone calls, etc., to ensure that the data is actually informative. The third lesson we learned is that there's a lot of rising expectations with these types of surveys where you're asking people about their food situation in a crisis scenario. The respondents to the questions actually expected something from us, which is not part of our intervention, that we're able to give food aid, for example. And other stakeholders, including the government and other development partners, rapidly realized the importance of phone numbers and wanted those phone numbers. But there were issues around this for us due to ethics concerns and agreements of confidentiality. The fourth is that you need a long-term plan for maintaining this type of data collection. For us, this was an injection of relief funds into a development program. Priorities have now shifted as COVID-19 has become the norm, and we are back to standard development programming, where the resources have shifted away from COVID-19 to other types of data collection and programmatic activities that must continue. The fifth is that data sharing and the visualization, etc., is extremely useful, but can be time-consuming if those networks are not pre-established. So just getting data sharing agreements and getting everyone on the same page between us and WFP and the government meant that the data was actually coming out and being shared with them after the data collection had been completed, which is not the ideal scenario. Last slide, please. As the next steps, we'll continue to roll out these food security questions as and when household level monitoring surveys occur, so that although it has stopped as a weekly activity, at least we will have a few additional periodic data collection points that we can compare back to the peak of the COVID-19 pandemic. We will also continue to share the findings with governments and other stakeholders so that we can continue to learn lessons about what happened in different locations. And a main effort that we plan to have in our next annual survey is that we would like to validate these results against other standard food security measures, such as the HFIS, so that we can understand a little bit better what these 2 questions that we had to modify at the spur of the moment actually tell us vis-a-vis other more standard validated measures that are used in contexts like Nepal. Thank you.
Hi, I'm Roni Neff, and I'm from the Johns Hopkins Center for a Livable Future and Department of Environmental Health and Engineering. And I'm going to take this to a high-income country context and talk about a survey that we've been working with in the United States. And I really enjoyed hearing from the other 2 panelists and the impressive and extensive projects that they've done. Next slide. Thanks. So a group of people across the United States came together towards the beginning of the pandemic and wanted to do a few things. One is to create a survey that would be broad and cover a number of aspects of food security, food access, and food systems, but also to make it available to groups around the country, including those working both in research and in practice-based situations. And so we created a survey instrument. We're now going into our 3rd revision of it. We put out do files for analysis, templates for policy briefs. We created a set of agreements for those who participate. We have regular meetings to build the network for data sharing and authorship and racial equity commitment. And everybody in the group agrees to prioritize communication of results before working on manuscripts. And we now have 17 partners in 15 states and a national survey, which I'll be focusing on today. And we're open to other partners. And this provides an opportunity also for data aggregation across scales. Next slide, please. So our conception of food security is broad. It starts with economic access, and for that we are using the U.S. Department of Agriculture's 6-item food security measurement. But we also have measures looking at physical access for domains of food acceptability, including utilization or kind of nutrition and food safety and things like that, health. Psychosocial and anxiety factors, preferability, and agency of people's voice in the matter, and then food availability. And this graphic also shows the interconnection of all these issues. So and I would say that these kinds of broad approaches are relatively more common in an international context and fairly rare in the US context. So in the national survey in our first wave, which I'll share, we did an online survey using a panel through Qualtrics, which is a firm that collects panels across the US. And it was mostly done in July 2020. We had 1,510 respondents, nationally represented by race and income. And we oversampled low-income households and then used sampling weights for income. And on Monday, we're actually releasing our first set of 4 briefs, and we've also got multiple manuscripts on the way. Next slide, please. So I'm going to jump right to the sort of what we learned from all this. And the first thing is thinking about the strengths and limitations of using these online panels. The benefit is that they're so much more affordable, and that makes it something that we could put out there and make this something that many groups could take up and use. When we got back our first set of data, we were finding some really odd results. Like, for example, food insecurity was higher the higher your income was. And we had done our own data cleaning, but we found that when we went through the official scrub through the survey provider, they were able to find a number of other things. And it seems like paying for that scrub really makes the difference, and we've heard this from others as well. Secondly, we and others who we've talked with who've been doing these surveys found multiple kind of findings that you don't know, is this something that we're finding that's really different, or is this a matter of the sample limitations? There's no data to sort of compare it against. The context is changing rapidly, so is it a matter of when exactly we did this? So there's some real challenges that we've had to work through in terms of how we interpret this and communicate it. Another issue that's arisen is, when we started, there was a real need for data, and there's still a real need for data, but many groups have taken up this mantle, and there's a lot of research going on in a similar domain. And so one of the things that I really think about moving forward is how can we coordinate and do advanced planning to have less kind of reinvention of the wheel moving forward. Another issue is groups working on very low or no funds to do this work. And in the current context, that has led to real challenges in kind of getting from here to there and getting the results out. And working with students and others have helped to advance that, but that's a real challenge. And the last thing I'll mention here is that as was mentioned in the other presentations, some of the traditional measures may be inadequate. I would say maybe inadequate instead of inappropriate in the pandemic context. And one thing that we've thought a lot about is, many people are worried about many things. And for example, like we found that those with the highest rates of food insecurity, those with the lowest incomes, were basically had the highest levels of worries across many different issues that weren't even directly related to their economic situation. And so how are those worries kind of playing out in terms of how we're measuring food insecurity generally? And then there's the issue of kind of broadening our construction of like, what does food access mean? It has kind of a different meaning perhaps in a situation where you may be worried to go into the store, where there may be threats to people who don't wear, like threats of physical violence based on masks and things like that. So there's a lot of other issues that come into play with sort of traditional conceptions like food access. The traditional ways we think about it are still really important, but we kind of have to expand our constructions. And another issue related to that is the time frame that was also mentioned by another speaker is like if we're trying to compare results from say a 4-month period since COVID started against a 1-year period pre-COVID, I think there's a lot of work in play to figure out how you make that comparison. In that second column, I just want to briefly share some results that came through. We did a sneak peek for advocates, and these were their recommendations for us. And so the first thing, and we also knew this very well, is like there's a real need to explain the differences and the unique contributions of what we're putting forward, given that there's many groups out there doing similar things. And how do we highlight and talk about how things are complementing and extending and put everything in context. And context is key as well. One of the things that they highlighted is the extent of focus on all the people who are newly food insecure and the need to also keep a focus on long-term food insecurity and the kind of different and powerful and structural issues that are contributing to that. And also noting the connection of food insecurity and the sort of economic struggles associated with it, with providing for non-food needs. In terms of policy relevance, they highlighted that as we go forward and seek new partners that might want to do the survey to really focus in on locations, for example, where there may be legislators of particular interest in this context. And so what kind of choices we might make there. And aligning the specific data that we choose to present in different places with the policy issues that are in play at that time. And then, as would be a common recommendation in any situation, thinking about how to communicate our findings in sound bites, Twitter, things like that, engaging partners. And finally, a message that came through at the end of that, which I think is useful to share in any context, is that they emphasize that now is a great time to be doing this research and now is a great time to be putting it out, and really highlighting and thanking all the people that are doing this research for the work they're doing. Thank you. Oh, and on the last slide, I'll just share, these are the partners in the executive team that led the national survey and that have overseen the general operation in our National Food Access and Corona Research Team. Thank you.
Okay, that was really great. 3 presentations that are really insightful. So I'm just going to make a few brief comments, and then we'll open it up to questions and further discussion. So I think some of the lessons we heard from India was about the importance of having the purpose and context firmly in mind all of the time, to keep what we're doing simple and to use complementary measures because things need to be brief. That highlighted was differences between coping behaviors and which are not necessarily universal, and experiences of food insecurity which tend to be more universal and tell us more than focusing on activities, and to see what works for the purpose in the context and then go forward with that. In Nepal, there was a really important lessons about that interpersonal communication is what's most affected, that we saw an example of integrating monitoring as part of intervention activities. The 2 items that are used in Nepal are actually the 2 sort of least severe items from the US measure of food insecurity, and therefore they're appropriate for assessing populations and changes in populations. In other words, they're not just a screening tool. They've been used as screening, but really its value here is that it has long use and population monitoring. We saw also, and Kenda described very well, the importance of systematically deploying the monitoring system and sharing of data and making sure others were on board and not wondering what these data are about. And then finally, the point was raised about how asking about food insecurity can raise expectations, you know, there can always be effects of asking a respondent about something, and they start thinking about it, and then there can be changes in how they're thinking as a result of even having this discussion. And then Roni showed in the US a really fantastic model of open science that was welcoming to and engaging with many partners. Even in countries where food insecurity is usually understood to be about mostly problems of access, disruptions to availability and other aspects of food insecurity can occur in a crisis like this. And so it's important to assess those. She talked about the importance of coordination among partners. There's been, tremendous interest. That's why we're having this webinar, tremendous interest in assessing food insecurity. And it's important to try as best we can to coordinate those interests. She pointed out that food insecurity is a strong stressor, as I said at the beginning, and therefore it can also function as a strong marker of other stressors. And then to really monitor what's going on, probably is trying to assess some of those other stressors is important as well. She talked about that differences in timeframes can make interpretation difficult, so that's something that's important in planning from the beginning. And then gave us some really nice discussion at the end about keeping the context and policy relevance firmly in mind in the choices about how to proceed so that the information is relevant and is used. So thank you very much for the three presentations. That was really great. And so we'll go now to the questions and answers. So one question is just to remind you to use the question and answer button that's at the bottom. So one question that's been submitted is, do you believe that the existing tools for the measurement of food insecurity can capture the breadth of the impact of the pandemic on food insecurity? So any panelists want to comment on that from your experience?
Hi, this is Roni. I guess I'd say it depends what you mean by existing tools. I think that the previously widely used tools may not have captured that breadth, but that there are tools increasingly being used and that were shared in this event that I think do capture more of the breadth. And I think it's also important to the extent that it's possible to also include some open-ended questions in these surveys so that participants can provide further details and extend into areas that we may not have thought about as we were designing the surveys. But we really tried to capture the breadth of types of issues in ours.
So, and then a follow-up was more specific, was about capturing the physical access dimension or availability. Can people actually get to the food even if it's out there in the environment? Is that, what have we learned about that as a problem, and what have we learned about how to assess that in any of the countries?
Yeah, I guess the follow-up question is related to the answer I was thinking for the first one, which is, I think that there are very good tools for assessing prevalence and degree of food insecurity in different contexts. I think what people want to know in a situation like COVID-19 is, why is food insecurity rising in certain places? Is it because lockdown and people can't get to markets? Is it because agricultural laborers are not being able to produce? Is it because there are more mouths to feed because migrants have returned? And so, I think it's important to not expect one tool to do everything, but similar to, I guess, what Roni was saying, to ensure that your overall survey, regardless of the tool that you use to measure food security, that you add in other questions that can help you to answer some of the additional topics that are closely related, but perhaps not part of the standard tool that's just trying to get at prevalence of the actual outcome.
Okay, Divya, any thoughts about this from the perspective of what you've seen in India?
Yeah, so actually echoing what everybody has said also, Basically, I do agree that a combination of tools has been useful. And as I mentioned, food security was just like a small component of what we were asking. We were asking a range of other questions, which I think together give a good sense of, who. The other question that we were interested in is which populations are most vulnerable, and geographically in terms of which areas in the country need, more support. So another piece was in terms of the analysis is, what's your unit of analysis? And for us, going as small as possible was useful. So for example, getting district level estimates was good, so that we could provide information on that. Similarly, looking at gender disaggregated information, I showed you a few graphs on that. That was useful. So I think, yeah, it's not just the tool, it's really like combining all of it and analyzing it in a way that gives you a sense of like who, why, when, how, all those questions, kind of tell the story together.
Thank you. So I wanted to direct a question to the panel in sort of general principles. If one's trying to monitor changes over time, there's kind of two ways to do that. One is to try to assess status at each time and then see how that status compares. So asking about, for example, limiting portion sizes as was done at one time and seeing how that changes over time. The other way to do it is to ask people directly. So what's changed? What's changed as a result of the pandemic, or what's changed in the last month? And I was just curious what your thoughts are from your experiences as to which of these two general strategies has been most fruitful.
I can jump in here because we've been thinking a little bit about this. Is really, when asking these kind of more open-ended questions, our experience is that the people who are able to articulate better what has changed are often the people who basically are better off in many ways, or have a sense of agency in terms of even kind of understanding or interpreting the difference over time. To be more specific, for example, I'm thinking of like labor markets and asking women, what have you been working on? And they it's much easier if you give them particular activities and ask them, have you worked on X, Y, Z, as compared to, are you, employed or not employed? And so similarly, I feel that it really depends on the frame that people are using, that they bring to the space when they're answering the question. And I think breaking it up is often more useful, specifically when you're using a phone survey and you don't have the context where you can make eye contact or you can kind of interpret body language, etc.
Okay. Any comments on that from Kenda? Any thoughts?
Yeah, I would concur. I think one of the challenges we've had when we ask open-ended is knowing if everything is being covered, if there's kind of under-reporting, and then also in a context where time is not well understood or not a priority. It's very challenging to to say what has changed in the last 2 months or 6 months. People can't really identify with that. So for that reason, we haven't really pursued that type of questionnaire wording in the COVID context, just from our prior learnings on that.
Okay, thank you. So there's a question from Allison Lacko directed to Roni that I'll repeat. It's about income and food insecurity. One of the filters that's used in the U.S. is the income threshold of 185% of the federal poverty line that's used for WIC, for example, and then 130% is used for other programs. And the question is this appropriate during the pandemic? Is it she's thinking about households that may be experiencing a sudden income shock, for example, due to job loss, but still have fixed costs like housing.
Yeah, I think that numbers like that can be a starting point, but it's really like one of the things that we do see is that there was in our analysis we distinguished we ran a number of the analyses based on new food insecurity, persistent food insecurity, and then food secure. And there were some marked differences between those two groups. And we did find that among those who were newly food insecure, there were a range of incomes. So it's a starting point, and it also speaks to those who may be experiencing long-term structural problems. But it's important to, we think, to not limit it. And that's why we did our survey at the population level as opposed to focusing in on lower income households. And should I just also answer the second question there?
Yeah, the second question is about what scrubbing means. I just want to say, for my part, keeping soap and water away from my computer is really important. So, but yeah, so what does scrubbing actually do, and how does that result in a more accurate assessment of food insecurity?
Yeah, so they basically, they do standard things like they look for gibberish in the open text boxes, which we did too, but then they did things like they had a number of different measures where you would expect to see consistency across them. And when you see inconsistencies, they'll sort of flag a whole bunch of ones where there's these, you know, and if you're finding multiple inconsistencies that are just like, that doesn't make sense that somebody would say this on this question and that on that question, they'll flag all those and then you can review them. And if there's enough of them, then we would say, let's remove this one. And so in terms of like, yes, we think that it's entirely possible that somebody could have had a higher income and then be food insecure now. But what we were also seeing was that they had a income over $100,000 and they were food insecure in the year prior to COVID. And there were a number of those, and that had been something that we hadn't picked up in our prior scrubs. So that was one thing that that they caught.
So, do you have any thoughts, Ronnie, about why this happened in this situation? Because those kinds of reports are pretty unusual in sort of the normal data collection that goes on in the current population survey or other surveys.
Yes, and I've heard it from others who are doing research now, and we have another survey out now related to food system workers, and there's that used a different methodology, but we also had a number of kind of wonky responses. And I think one is there's just a lot of surveys with all the researchers at home and they can't go out and do things in person. There was a lot of surveying going on. And people, you know, there's an incentive. And so people kind of rush through it and click anything to get that incentive. And it's possible also with the heading into the U.S. elections, there were even more surveys going on. And so my guess is that a lot of it had to do with that, but I don't know for sure.
Okay. Please, if there's any other questions, put them in the chat box. Whoops, maybe there is one. No. Yes, so Andrew Thorne-Lyman asks about in phone surveys, is it possible phone surveys could lead to less bias because respondents may not see the possibility of benefit, or they might be less social desirability bias compared to in person? And does anybody know if that's been studied?
I can jump in here. I think it really depends on the context and the questions being asked, because this is a good hypothesis. And I think, you know, again, because we're looking a little bit deeply into gender, what we found is that, for example, if women have access to a phone and they have space, to be able to answer questions that you know, they wouldn't normally answer. For example, adolescent girls, you know, they are kind of more savvy with phones, and so potentially using a phone could be a good way to reach them and get good information. On the other hand, a lot of, you know, there is data showing that women have to sometimes use you know, put the phone on speakers. And the surveyor often doesn't know that. And so when the phone is on a speaker, you can imagine that, there is high social desirability bias. They are basically answering questions that are acceptable to the whole household. And so in that case, you're not able to kind of get the kind of information that you'd want. So it really depends on the context and the question. And the problem is often you don't know what's happening on the other end.
Okay, great, thank you. So I guess another question I'll put to the panelists is so I don't know, the onset of the pandemic, once it really hit, was fairly abrupt, but as we move out of it, it's hard to know what's going to happen, but it could be quite a bit more gradual, even though the signs about the effectiveness of vaccines is high. It'll just take a long time to roll them out and get them distributed to the population. So we may be looking at quite a long time of diminishing transmission, but still substantial transmission. So what do you think the priorities are for monitoring then going forward, through, I don't know, the next year, I guess? Kenda, any thoughts about that?
Sorry, Ed, I was trying to send a link to a manuscript that gets at the question that Andrew had posed on comparing face-to-face versus mobile phone. So I missed the question. Could you repeat?
Oh, I was just saying that I think even though the vaccines look promising in terms of being, more than 90% effective, which was not a guarantee, we're probably looking at many months, maybe a year of sort of gradual reduction in transmission before the vaccines are really deployed. And so what do you think that means for what your priorities are, or what should the priorities be where you're working for monitoring during this time?
Yeah, it's an interesting question, because what we started seeing even toward the end of our data collection, which was now 2 months ago, I guess, when we stopped doing this round of food security data collection, the numbers had calmed down, almost kind of indicating that households had adjusted and this was kind of the new normal and no longer the crisis situation. And we're increasingly in the country, whereas during the peak of the pandemic, people seem to really be focused on food security. We're not hearing that kind of question or demand from data, at least from the government and other EDP partners. There seems to be more questions around service continuity and what is holding back health workers and households from going to services. So I know a lot of our monitoring efforts are changing to try to understand uptake of maternal and child, health and nutrition services, and also commodities and supply chains that have been disrupted due to lack of transport across borders and things like that. So it does seem like the intensity of food security, I don't know if it's just a perception that it's all okay, or if, maybe again, it's related to context. I mean, in Nepal, most people, 90% of households are still growing at least a portion of their food at home. So again, I think it might vary by context, but for us, it seems that has lessened, and it's more an issue of why aren't people moving around and going for other services, and how can we get people to do that again? Because we know that if disease outside of COVID increases, we're gonna have bigger problems on our hand as well. So that's where we are right now.
Yeah. Now, Divya, any thoughts about that question?
Sure, yes. I do think it's important to continue, having a pulse on what's happening. But I agree with Kenda that things definitely seem to have kind of stabilized compared to, for example, in April. And, that's great news. But I think it's, very important to continue getting, granular information that everybody can use in terms of understanding, like, who's getting left out and what to do. On the what to do, I do think it's important to kind of understand now, in the context of COVID, like what systems are working and how to improve them. So I think, there was this kind of pushback from various parties as we presented this data also is that, okay, you're telling us a lot about what the problems are, but now let's talk about the solutions. And I think that is where I think there's most value to add in terms of understanding, okay, how do we kind of move forward? Because at least a lot of the monitoring is kind of problem oriented.
Okay, great, thank you. So there's one more question that's directed to Roni. So let me ask that and then we'll have to close because of the time. So the question is about how the Qualtrics survey was distributed and promoted, and was there concern about losing households that didn't have access to internet or Wi-Fi because of the pandemic?
Yes, so let me briefly answer that and also talk about the other one. The Qualtrics is distributed to an online panel, and so many people answer it on their phones. So there's definitely a concern about losing some households, even though we tried to be as representative as possible. I just want to just briefly say, in terms of moving forward, I want to echo what the other speakers said. And two other things I want to point to think about is that there's a lot of new innovations that have gone on in programs and services during the pandemic, and we need to assess how those are working and assess kind of what changes are needed moving forward. This is going to be a long haul in terms of the economic impacts, and so how do we build on the benefits and improve resilience, and what can we learn about that through repeat surveys over time? And how do we keep this issue of hunger in the spotlight, even as things supposedly are improving? It's not, it may not be improving for everybody. Thanks.
Okay, great, thank you. Okay, so we're at the hour. I want to thank our three panelists who have just done a fantastic job in their work, and also in conveying it to us and to Riley and the Data for Nutrition team for organizing this. Kenda, the article you mentioned, if you could get that to Riley, that reference, then it can go out in the notes. So thank you, everybody. Thank you for those who participated and contributed questions, and so we'll call it here. Okay, have a good rest of the day.
Thank you.
Thanks.